Good evening. My name is Chris Martin. Welcome to Feet Forward with the Illinois Podiatric Medical Association. I'm sorry we missed you in December, but due to some of the heavy weather that we experienced, we couldn't make it in for the show. We apologize, but we'll make it up to you. We're going to have the same show tonight that we were going to plan in December. We're going to talk about house calls, especially with the elderly. And now that the weather is really bad, I mean, it was bad in December, but it's really bad now, especially for seniors. They can't always get out of their condo or apartment or home to visit the doctor. Podiatrists, more than most other healthcare professions, I believe, will come and see people. And we have a fine member of the podiatric profession, Dr. Kirk Contento. He is a podiatrist of 27 years. He has a practice in Palos Hills and Chicago. Welcome to the show.
Thank you, Chris.
All right. We want to talk about, a lot of people may not be familiar with a house call because they're so used to going to a doctor's office and getting care either in a physician's office or a podiatrist's office. So a lot of people may not be familiar with what actually goes on in a house call. So why don't you tell our viewers kind of what to expect from a house call, and then we'll also tell them sort of how to access care that way.
Well, first of all, the venue is changed from the doctor's office to your home. So you're in a very comfortable atmosphere, which is your home, and you can have any problem with your foot outside of x-rays and lab tests performed in your home. If you have a sore on your foot, or you have some corns and calluses, long nails, an athlete's foot infection, if you're a diabetic and you are concerned about problems you're having with symptoms that you're not familiar with or you didn't discuss with, say, me in my office, you can call me or you can call a podiatrist who does house calls to take care of you in your own home. And it's a nice change of venue because the ball's in your court. I'm not in complete control because you're not in my office anymore. I'm in your home / office.
Do you find that patients are more readily, they're more likely to accept the treatment recommendations and are more comfortable in that setting?
Yes, I think that's definitely a factor because of the fact that they're in their own home, and it doesn't sound like I'm actually telling them what to do. It's more of a mutual type of agreement because they have a problem and I'm discussing it with them in an atmosphere where they're extremely comfortable and they're more acceptable to the treatment plan. In fact, I would honestly say that my house call patients are more compliant than the patients that come to my offices.
That's interesting. That's interesting. For those seniors that are watching now, please call in and we'll be happy to answer your questions. What's a typical sort of house call like for you with most of your patients that you're doing?
Well, actually, a typical house call is usually more conservative type of care. What you mean? Want to know what kind of treatment modality?
Yeah, a typical house call.
A typical house call is a patient calls and says that they have long nails or they have corns and calluses. Corns are hard excrescences on the top of their feet or on the bottom of their feet, or they might have some swelling in their feet, or they might have twisted their ankle, and they might have an ankle sprain that has swelled up on them. They can't get into the office, and it's more convenient if I come to their home, examine them with any of these problems, and start a treatment plan right on the spot. Usually, what's going to happen is that you're going to get relief from the first time I come to see us. So it's not like you're going to have to come back to my office 5 or 6 times over the next month or so to get to where we want to get. I'll be able to treat you right on the spot and get some results right away.
That's great. That's great. Now, how would a patient find you? Are there a lot of podiatrists in Chicago that do house calls?
There's not that many podiatrists in Chicago that do house calls. Now, the Illinois Podiatric Medical Association does have a database that has their membership who do house calls. So if you want to know a podiatrist in your area who does house calls, and your own podiatrist in your area who you see on a regular basis does not do house calls, I would call the Illinois Podiatric Medical Association and see what podiatrists do house calls. The reason being is that a lot of doctors don't like to do house calls because it's too time consuming for them. Although I regard it as a service that is very convenient for the patients, and it makes it easier, like as you said in the beginning of the show, with the colder weather and the area, the ground being slippery. I mean, I don't even want my patients who are normal patients of mine who come to my office, if they're elderly, to go out in this type of weather. So I usually tell them, as a service to my current patients, you can have me make a house call, which is a lot easier on you and a lot easier on me, less I have to worry about you slipping and falling in front of my office.
Now, are there special qualifications, or is there a certain age limit or a certain type of patient that would be eligible for a house call, or would you gladly visit virtually all of your patients?
I'd gladly visit almost any of my patients at home, but most of the time it is a senior citizen group, Medicare patients, because Medicare does cover house calls. Most third-party carriers, other insurance companies do not cover house calls. And even if you have a policy that is not Medicare, they're usually not going to cover it. But I can be honest and say that even when people call my office for a house call, that when I ask them what kind of insurance they have, and if they don't have Medicare, and I usually quote them a price over the phone. In the past 27 years, I've never had anybody say, no, I don't want to pay that. So it's fairly reasonable. And, of course, sometimes when I'm on your turf in your home, and you call me up and say, well, you know what, maybe if you're going to do this, that, and the other thing when you get here, maybe we could negotiate out the price. I don't have a problem with negotiating out the price if you don't have insurance, because I just want it to be the result to be fair to you and to be compliant and get the results that we want.
Let's talk a little bit about Medicare, because there may be some confusion about what Medicare actually covers and how people would go about accessing that. So why don't you talk a little bit about that? Actually,
Medicare will cover the initial house call and any follow-up house calls on any Medicare patient. It's the doctor's decision to submit that to Medicare. There are certain things that they don't cover, and they're the same things that they don't cover in your office. So there are certain parameters that Medicare doesn't cover every service that a podiatrist gives. So there are certain services that Medicare will not cover. Now, what Medicare will cover is the fact that once the doctor or podiatrist goes to your home, whatever he needs to do, once he gets there, they're going to cover those services in addition to what's called the house call, the treatment modality of going to your home. And let's say if I went to your home and you had an ankle sprain and I had to strap up your foot, they would cover me coming to your home and whatever strapping procedure I knew to strap up your foot.
Do you find that a lot of people are surprised that Medicare provides such a nice
actually, most people are not aware of the fact that Medicare covers house calls, and actually, a lot of people do not even know that house call is a service that doctors can give you. It's not just podiatrists, but any medical professional can make a house call. A chiropractor, a medical doctor, they can all do that if they choose to do that. But they are services that Medicare does cover. And actually, there was just an article a couple of years ago that was published by Mayo Clinic Proceedings, and the article dealt with the fact they're tracking people who had house calls across the nation, and what they found is that people that had house calls stayed out of the hospital more than